Hello, and welcome to the channel. Now, I know what you're thinking. Another video about a magic cure for ED. Look, it's 2025, and we're all adults here. If you're under 18, please go ask a parent about the birds and the bees. For everyone else, we're going to be talking about something that affects millions of men. Erectile dysfunction. It's a topic often shrouded in awkward silence and late-night infomercials, but it doesn't have to be that way. We're going to take a look at the science, the solutions, and yes, have a few laughs along the way. So, buckle up and let's delve into the world of modern ED treatments because everyone deserves a happy ending. Number 1, let's start with the heavy hitters. Oral medications. We're talking about Viagra, Cialis, and Levitra. These are your PDE5 inhibitors, working like a well-timed traffic light directing blood flow. They're popular for a reason. Pop a pill, and you're potentially ready for action. But like that suspicious gas station sushi, there are a few things to consider. They don't play well with all medications, particularly nitrates. And just like any good party favor, they come with potential side effects. Headaches, flushing, maybe a stuffy nose. The point is, talk to your doctor to figure out if oral medications are right for you. Number 2. Sometimes you need results faster than a pizza delivery during the Super Bowl, and that's where injection therapy comes in. Yes, you heard that right. Injections. We're talking about injecting a vasodilator directly into the base of the penis. These injections work by relaxing the blood vessels, allowing for a more robust flow. The upside? It's fast-acting and effective, even for men who haven't had luck with the little blue pill. But there's a reason why this isn't everyone's first choice. Needles and penises aren't exactly a match made in heaven, and there's a small risk of priapism, an erection lasting longer than 4 hours. And no, that's not a good thing. Number 3. So, we've tackled pills and injections. Feeling squeamish yet? Well, buckle up, because next up we have urethral suppositories. Essentially, it's a tiny medicated pellet inserted into the urethra. The good news is that it's less invasive than injections, and nobody has to look at needles. The not so good news? Some men experience urethral burning, and it's not as effective as the injections. Number 4. Pump it up, vacuum erection devices. Time to put aside the pharmaceuticals and delve into the world of mechanics. Vacuum erection devices, or VEDs, might sound like something out of a 1950s science fiction novel, but they're a very real option. Imagine this: a cylinder, your penis, and a pump. You create a vacuum, the blood rushes in, and voila, you're good to go. The upside is that it's non-invasive and drug-free. The downside? It's not exactly the most spontaneous thing in the world. Number 5, the nuclear option penile implants. Now we're getting serious. Penile implants are the heavy artillery of ED treatment, reserved for cases where other options have failed. It's a surgical procedure, folks, so you know it's not for the faint of heart. There are 2 main types, inflatable and malleable. Inflatable implants are like having a personal hydraulic system installed, allowing for a more natural erection on demand. The benefits? High satisfaction rates, spontaneity, and you basically become a walking, talking magic trick. The downsides? Well, it's surgery with all the inherent risks. Number 6. Remember testosterone, the hormone that makes you, well, you? Turns out it plays a crucial role in erectile function. That's where testosterone replacement therapy, or TRT, comes in. Think of it as refueling your body's sports car with high-octane fuel. It comes in various forms: injections, patches, gels. But here's the catch. TRT isn't a magic bullet for ED. It works best in conjunction with other therapies, like those little blue pills we talked about earlier. It's like a tag team match with testosterone and PDE5 inhibitors joining forces to deliver a knockout punch to ED. Number 7. Let's talk about shockwaves. And no, I don't mean the 1985 German film. Low-intensity extracorporeal shockwave therapy, or LI-ESWT, is a relatively new treatment that sounds like something out of Star Trek. It involves using low-energy shockwaves to stimulate blood vessel growth in the penis. The early results are promising, but it's still early days. Lastly, number 8. Sometimes the root of the problem isn't physical, but rather lurking between your ears. Stress, anxiety, relationship issues, they can all put a real damper on your sex life. That's where therapy comes in, specifically Cognitive Behavioural Therapy, or CBT. Think of it as a mental tune-up, helping you address the psychological factors contributing to ED. The benefits? You'll address the root causes of your ED and improve your overall mental health. It's a win-win, really. Unless, of course, you hate feeling happy and fulfilled. So there you have it, a crash course in the wild world of modern ED treatments. Remember, this isn't a comprehensive guide, it's more like a starting point. If you're struggling with ED, don't suffer in silence. Talk to your doctor, do your research, and remember, you're not alone. Millions of men experience this, and there are solutions out there. And hey, if you found this video even remotely helpful or entertaining, do us a favor and hit that like button. And while you're at it, why not subscribe for more informative and hopefully humorous videos? We promise to keep it real, keep it informative, and keep it below the belt.